that for me and so forth, and he's kind of been my point man in doing this. So.
And I also spoke with Lieutenant Walter just this morning, and it's going to be the same route they use for the fall festival that Cecil College uses.
Correct.
And so they'll use the same pattern.
And I believe that the hospital has granted us the third level of their parking garage to park vehicles and so forth, and we did check with the college, and there's no activities pending that day for them as well.
Now, I assume our Public Works has been notified as well. Chief, I guess get that all set up. Have the barricades and everything all set up for Public Works and stuff. I guess they've already notified them. Okay.
Certainly do.
Okay. All right. Anyone have any questions?
I assume that your entry fee is going to be the thing that determines your funds?
Correct, yes, sir. Our entrance fee is $20 per runner. And we contacted Chick-fil-A and Elkton. They're sponsoring food for the runners and t-shirts for that, and sponsor-wise for us.
Very good.
It's the first time we've done this, and we're hoping that it goes well. And
That's one way to try and, I know everybody needs some money, and maybe that's the best way to do it, you know, try to have some kind of fundraiser, so to speak. Okay, anybody have any other questions? All right, do I have a motion to,
So move that we support their endeavor.
I second it.
any further discussion? All those in favor?
I just want to, first of all, thank Mr. Smith. At the last minute, he made some phone calls and arranged for the kids that had football down at the Meadow Park. We were told that it was going to be closed on Monday all the way through the week, and thanks to him, the kids started practicing right at Monday without a miss of any days, thanks to Mr. Smith and the Christian Academy. Thank you.
sir, you're welcome.
No, thank you, yeah, definitely, thank you.
Yeah. Anytime we can help, and we realize that we have some property and facility, and we realize the impending floods over at Meadow Park, so anytime we can help, we're happy to do so.
Okay.
I appreciate your help with us as well.
All right, thank you.
Thanks, guys. Appreciate it.
Okay, priority partners? Come up.
Some person in conversation. Thank you for this opportunity to speak to you all. Grateful. I am Tom Blanchard with Johns Hopkins Healthcare Priority Partners. And if I can give those to Michelle and distribute those. And a copy of my presentation as well as some other information. And you each get a purple pen.
The Ravens color, somebody?
Yes, sir. Yes, sir. I hope that's okay up here. If I can get this technology to work, we will be in good shape. I'm not the most technical person. My younger brother is a physics teacher, and when he and I were kids, we used to put puzzles together. So for his birthday, I gave him a cardboard puzzle with 500 pieces, and I called him not too long afterwards and said, "How'd you make out the puzzle?" He said, "Got it all together." He was all excited. I said, "How long did it take you?" He said, 5 months. I said, 5 months to put a 500-piece puzzle together? He said, "Yeah." He was really bragging about it. I said, "That's nothing to brag about." He said, "Really, the box said 4 to 7 years." That's the extent of my humor. I do try. Our kids thought I was going to entertain myself. I'm here to ask you all for help. I've been doing this presentation around the state of Maryland. I literally put about 500 to 1,000 miles a week in my car, and I love it. Because I'm here to ask for your help, because I have something to give you versus to ask. I'm not here for money. I'm here to give you something free. The town, the county, and the entire state. It's healthcare, and healthcare is on a topic of many folks nowadays. And there's a lot of controversy and a lot of promotion and discussion about healthcare. So I'm here to share some information with you that may be of help to your communities, to your schools, to your citizens around the county, and certainly throughout Elkton. But, whoops, sort of I'm not technically oriented. Let me get this running right. But right now, there are over 700,000 people in the state of Maryland who are using these programs. Unfortunately, there are well over, it's back there somewhere, there it is. There are well over 200,000 people in the state of Maryland who are uninsured. They have no insurance, no health care. They go to the doctor, they can't pay for it. And unfortunately, most folks just don't know about it. The programs are out there, and that's why I'm here, and that's why I appreciate the opportunity to chat with you about this. So the state put up some programs to address those, and that's a very conservative number. It's not based on the 2010 census, so wait and see what the numbers are going to be. We got a double image going here. So let me give you some a quick overview of what I'm going to cover. I want to tell you about the programs, how people are eligible, and how you can enroll. I want to tell you about some free health education workshops. There's information in my folder about that as well. And I also want to tell you about some community partnerships, things that we do at Johns Hopkins Healthcare. So we just don't provide healthcare or administer the insurance program. We're very involved in other components, and I want to share those services with you. We've been sharing those throughout the state of Maryland. It's been a wonderful experience. The state of Maryland has insurance programs for, something has on my slides here, being cut off. But for families and individuals, so I hope that's what it said. The programs are administered by Maryland's Department of Health and Mental Hygiene. And then they created this program called Medicaid. Now you know what it is, Medicaid. And it's for anyone between 0 and 64.